now going to go through administration of inhaled medication, or AIM. So before you start, you obviously just need to do your hand hygiene, okay? So do your proper hand hygiene, and then you can say hello to the patient. So this will be a mannequin. You're not going to be doing it on a real person, but you can still converse with them, to show your conversation skills and communication. So hello, my name's Chloe. I'm here today to administer your inhaled medication. Is that all right? I'm going to explain to you in detail what this involves so that I can gain your consent, okay? So, as this is a medication that you're giving, obviously you need to make sure that you've got the right patient, so you need to do a full identity check, okay? So you're going to have a prescription, like on an A4 piece of paper, a bit like in your subcut injection and your IM injection, okay? So you just need to check the patient's details against either their wristband or against, like verbally, so depending on whether you're in a community setting or in a hospital, but just make sure you do a thorough identity check. So I'm just going to confirm that I've got the right patient. So Emma Smith, you're going to repeat this back to me, the patient will repeat this back to you. I've got Emma Smith, date of birth 19th of the 1st, 1974, from Belfast in Ulster, and postcode is BN32QL. So if I had a hospital number, I'd check the hospital number as well. And I'm just going to check all of those details, so I confirm I've got the right patient. Do you have any allergies, Emma? So Emma says she's got no allergies, so that's fine. So we can proceed to giving your medication, okay? So I check the prescriber's signature is Dr. Thompson. I've got today's date, and the time is 12 o'clock, which is the time for my scenario. So everything is in order. So this looks like a good prescription. So I'm happy with this prescription, so I can use this, it's safe. So now I can just give my medication. So I'm going to go to my patient, who's just here, and now I need to give them clear instructions of how to take their medication. So just make sure that you give clear instructions, a bit like with your peak flow. You need to just be really good communication in this station, because it's a simple skill, so you're showing other skills, okay? So Emma, what we're going to do is I just need to make sure you're sitting upright. So if your patient's not sitting upright, then they need to sit upright. They can't have their inhaler when they're lying down or anything like that, really. They need to, you need to get full expansion of the lungs. So you're sitting in a good position, so that's okay. If you weren't, I could assist you into an upright position. What we're going to do, Emma, is to give your medication, and we need to give you 2 puffs of your inhaler, okay, via this spacer. So what I'm going to ask you to do is I'm going to remove this cap from your inhaler, and then I'm going to shake this for 2 to 5 seconds, so 1, 2, and then I'm going to insert this into the end of the spacer, into the device, and then we're going to remove this mouthpiece cap. And then what I want you to do is to place your lips around the mouthpiece here, sealing it nice and tightly, and then first of all, you need to exhale out and then place your lips around the mouthpiece. So breathe out first, put your lips around here, and then press down on the canister, and then breathe in and out normally for about 10 seconds, okay? And then I'll remove this, and we'll wait about 30 seconds, and then we'll repeat the second inhalation, okay? So, do you understand all of that? You can ask your patient to repeat it back to you. It's a good way of making sure that you've given clear instructions, and also if they repeat it back to you incorrectly, it's giving you a chance to correct yourself and give you a better chance of passing this station for your OSCE. So it's always good practice, I think, to get them to repeat it back, because some patients will say, well, they understand, but then actually when you do it, it's done wrong, and then you have to do it all over again. So it's good practice to do that. So can you please repeat that back to me, Emma? So they repeat it back to me. I'm happy with that explanation. So that's all good. So we're going to start now. So is that all right? Okay. Oh, by the way, Emma, I'll just tell you that salbutamol, I know you've had this medication before because this is your regular medication, but side effects of this can include like you can get a bit shaky, and sometimes you can get some palpitations, and also you can get like oral thrush and things like that. So it's a good idea to rinse your mouth out after you've had your medication. So all right, you happy to go? Okay, so breathe out for me. Okay. And then you would ask the patient to hold this themselves, but as it's a mannequin, they can't hold it themselves, but really they'd be holding it. Okay, so similar fill your mouth slowly around. There we go. Okay, I'm going to press the canister. Okay, so you can just breathe in and out normally. Okay, so usually about, 10 normal breaths or so, about, for them to get the full amount of the drug. Okay. All right, that's good. Okay, so you're breathing in and out normally. So if you just wait until I've removed the mouthpiece before you exhale. Okay, so now exhale, please. Okay, so we'll wait about 30 seconds now and repeat that. So I'm going to shake this again for 2 to 5 seconds. 1, 2. Okay, I think that's been 30 seconds, so we're just going to repeat that. So breathe out, please. I'm going to put this in your mouth. Wouldn't usually be this forceful with a real person, as it's a mannequin and you want to get it in. And then we're going to, okay, and breathe in and out normally, please. Okay, for about 10 breaths. Each medication might be different for the amount of time it will take to be inhaled. Okay, I'm going to remove that now and just wait till I've removed it before you exhale. Okay, and exhale, please. So you feeling okay? Yeah, just make sure your patient's, feeling all right. No side effects of that. You can replace the cap. I'm going to take this out, put the cap back on, and I'll store that according to the policy for your safe storage of medications. If it might be the patient's own, so just put it where they want you to put it. And then you need to wash this. So you can wash this in warm soapy water. Don't rub the inside of it because it's got a special coating on the inside. So just swish it around in warm soapy water. You can remove all of these parts. It all comes apart, and then just rinse it with warm water, leave it on the draining board to dry. Don't dry it, just air dry it, don't do anything else. And you can see on here actually it says replace in 12 months, so that's a good thing there. So I'm going to make sure that I've washed that according to protocol, and I'm going to document and sign my drug chart, so because immediately signing as soon as I've given the drug. So I'm going to put my name, and I'm going to sign and date and put the time. Right, lovely. All done, Emma. You feeling okay? I'll be around to monitor you now for the next 30 minutes or so, just to make sure you're feeling okay. Just, I'll get you some water so you can just rinse your mouth out with some water, so it's good to rinse out after you've had an inhaler. Any questions? Do you need anything else? Just make sure that the patient's position is comfortable and they've got the possessions nearby them and everything like that, just to wrap it up. That's it, you're done.